I think this statement is very important statement from John Charnley. I hope Peter K knows this. There is no doubt the orthopedic surgery, acrylic cement is going to be widely used in many different parts of the world. There is equally no doubt that its use by uninformed operator will produce complication which might seriously threaten its reputation and might hold back the progress of science. And this has absolutely happened. We all follow our Swedish registry from because this is the HIP registry from '79, and it gave quite a bit of idea to us that it does the systemic implant surveillance. It avoids catastrophe, and that's why the metal on metal has been completely. There is no problem in Sweden because it was not introduced, and they had only 6 type of stents, so they are able to analyze extremely well and 10 times on the stabular cups. And they have recently started work on pioneer on hip hemiarthroplasty, and they concluded that the lateral approach is preferred for these fractionate femur hemiarthroplasty patients. And cemented stent preferred in spite of there's a lot of international pressure from all the sides, but still they prefer cemented stents. These are some couple of examples from my professor and myself from our own unit. This 17-year follower, 23 years, 35, and 44 years this down. Man is waiting for the cup revision, even in spite of trochanter non-in, and this is a 44-year-old, 44-year, it looks quite well, cemented stem. This slide already Pete became it. That was the generation 1 and generation 2, which I'm talking of 44 years. But looking at the modern cement, and that thing looks that this is going to be better in future. So we don't have enough data coming from modern cement, how long and how the graph can be. This is only 8 or 9 years follow. We have to look for another 10 years for a modern cement data. The Swedish registry looked at 25,000 in 2019, and you look at that, cemented stems are almost 45% in a male patient and 62% in a female. So there is no question that the cemented stems still are preferred in Sweden. What about the Finnish Orthopaedic registry? 9-year survival rate of a cementless hip are only 65%, which is not good. And this, what they quoted was inferiority of the cup and its locking mechanism. So it was not preferred in their in Finland. What about Norwegian registry? They are the first people to start what is called implant library, which can detect the failure. They had element-digit personal identification. They could bring the patient back for the regarding the data for revision. And they looked at the first 5 years, cemented hips still they did better. And 10 years follow-up, uncemented had a poor performance due to the wear. And that I surprised Peter K. and Ross. Both of them never commented about the wear rate in uncemented and wear rate in cemented. I think we have to look for that, and there is a lot of good data coming that cemented cups have a low wear rate. What about the NJR, which I think discussed by Peter K. There's a 15-year survival. Younger patients, yes, we agree. As the age advances, revisions drops down because the demand is very, very low. And that's the largest national registry. And their data, the hybrid hips are going up. 32 head has been now in cemented and uncemented, both are preferred by them, so that the rate of dislocation can be on the lower side, and we are using a highly cross poly. Bearing choice, I think cemented metal on poly is almost 86% of UK registry codes, and dual mobility, even they are quoted that more revision than the non-dual, so that is not an option for every patient. And definitely hybrid and uncemented hips they are preferred on ceramic and poly. And this is a very important data, which is the cemented hips are still studying about 20 to 30% in UK, and hybrid has gone up. So almost 50% of the stems in UK are a cemented stem, which Peter K. quoted. What about I told you, revision rate for 32 is on the lower, and above 32, the revision rate is on the slightly higher side again in UK. What about Australia? Yeah, I think this is the slide again Ross had pointed out, but looking at that, about 60 to 70% are uncemented, and the cemented stems are almost about 10 to 15%. If you look at the community revision, cemented, uncemented, and hybrids, there's no major difference, except the hybrids are slightly doing better. So there's no question the people used to feel that the cemented stems have very high failure rate. At 15 years follow-up, there is no much change between cemented and uncemented as far as their community revision rate, that is from Australian registry. What about the National Registry of USA? And this is again collaborated with AOS and AOS. And this is again a very, very large data, but they are not full member because they are not able to get 100, more than 95% of the data. So that is there is another possibility of the statistics for these patients. What about their own data of cemented? Even though in USA, if you look at that, under the 50 years or more uncemented are used, but as age advances, there is a cemented stems which are much more, especially for fractional femur. And again, 2012, there are only 2.7% of the cemented stem, but today, 2019, there are almost about 5.5 or 5.3%. So it is numbers of cemented stem. Even USAs are increased, but at advanced age. What about the fractional femur? If you look at the really fractional femur, whether hemiorthoplasty or a total hip, in total hip, almost 20%, 15 to 20% stems are used, are cemented stems, and for a bipolar, that is, by hemiorthoplasty, almost 50% patients are using, they are using a cemented stem. And this is also as age advances, more and more cemented stems are used in USA. And this is very important slide. About 10 years back, there was a lot of controversy regarding the revision rate and revision burden in USA, because Sweden pointed out to USA that your revision burden is much more. And you look at the revision burden was 13 to 14%. With the registry data, within 5 years, US has brought down a revision burden to 4%. This is the greatest achievement US registry has done. And why? Because they were able to reach the surgeon, tell that what implants are suitable, what implants are doing better. And this is one of the important results that has come out from the registry of US registry. How can you contribute from our Indian registry? We have a small data of Indian registry because it is a voluntary registry. We are trying to actually pursue our surgeons to join this data. And this is our own data coming from 2006. We had a trial, and after that we are already in place. We are in place, and now it is handled by Norgate UK, which are maintaining the registry. Our problems are 50% of our patients are avian, they're younger patients. That's why most of the Indian surgeons are using an uncemented, because they think that uncemented stems, younger patients will be better because the revision rate will be lower, which is not true, what we just heard. Our BMI is again high. We were thinking that Indians we do not have a very big MI, but we just compared with the UK BMI and our patients, and we are almost same. We do have a high BMI in our hips. The knees are much more. It is almost 30, and it is in the hip it is 27, which is also on the higher side BMI. Looking at our own data of cemented and uncemented, I agree that our cemented stems are from 20% to now we are gone to 10 to 15%. But this is not a real data because it's a very small proportion of this surgery done in the country. And secondly, there's a high volume centers who are doing. If you look at the periphery, probably we are doing around 20% of the cemented hips in our country. That's my prediction. So what do you take this message of this cemented stems have stood the test of time, which all of us heard from all the top speakers. Cemented cups needs to be more research, and I've just wondered where somebody can comment by the Gross or Peter K. Where in cemented stem is low. This was actually proved by a very little lab, which we never looked back again, and we have never focused this the wear rate of uncemented to cemented. It will be our duty actually to teach the science and the art of cemented hips to our younger generation. We need to avoid external sources to our practice, which we will discuss just